My name is Dr. Fred Arnold. I'm a naturopathic physician located in Scottsdale, Arizona. Our practice is Scottsdale Regenerative Medicine and Wellness. I'm here today to talk to you about prolotherapy and the knee. The knee is probably one of the most common conditions that we treat at our office. Many patients have had sports injuries, slips and falls that results in a painful knee by the time that they come to our office. We treat a variety of different conditions involving the knee. Arthritis is probably the single most common condition that we treat. This is not a steroid injection. I wish people understand that this is not a steroid injection, this is prolotherapy. Basically, the solution that we use in prolotherapy is dextrose, lidocaine, and a B12. This creates a healing response in the body to repair tendons, ligaments, and cartilage. We have our model patient here with a few dots that I've placed on their knee to show where some of the possible injection sites would be utilizing prolotherapy for the painful knee. Both the inside and the outside of the knee, both interarticular and extraarticular points need to be treated when we treat a knee, because we're involving the ligaments, there's tendons involved, there's cartilage involved, and one shot, like with a steroid shot, is not sufficient to adequately rebuild and strengthen the knee. So as you can see, I've numbered a number of different points here that would help identify the painful areas, and then prolotherapy would be administered to those individual dots. When you come to the office, I personally meet with you, I review your case history, we performed a detailed examination involving your knee. I ask that you please bring in the x-rays or MRI reports involving your painful knee so we can review that during the session and determine the most appropriate treatment for you at that time. It is my personal goal to help you reduce your knee pain as quickly as we can. Prolotherapy has a proven track record to treat painful knees, and we try to do this in the least number of visits possible.